Toronto announces its request to extend its stay-at-home order into March. Here's Eagle News correspondent Astley Sacmar with the report.
Officials from the City of Toronto, Canada have announced Thursday the request to extend the city's stay-at-home order until at least March 9th. Details were given by Mayor John Tory. Take a look.
Today, Dr. Davila will be detailing her professional public health advice, which has been provided to the province, recommending extending the lockdown in Toronto for an additional 2 weeks. This is based on public health's significant concern around the new COVID-19 variants that we are starting to see in settings across our city. Confirmed cases of the variants have turned up in long-term care, hospitals, one shelter, and in a meatpacking plant, for some examples.
Dr. Eileen Davila, Toronto's Medical Officer of Health, also reported the number of variant of concern cases in the city.
There are 56 confirmed variant of concern cases in Toronto. 54 are the UK variant B117, and 2 are Brazilian variants. A week ago, there were 33 confirmed cases of COVID-19 variants in Toronto. Today, we have 56. In fact, there are more than 5 times that number being confirmed in the labs right now. 283 cases from Toronto that have screened positive as variants of concern. But today's variant count is the tip of an iceberg. By the time the confirmed case counts are big enough to shock us, it will be too late to do anything. We will be in a third wave, as bad as anything we've been through thus far.
The discussed variant of concern is a mutation of the COVID-19 virus, or the SARS-CoV-2 genome. The variants are reported to spread more easily and is suspected to affect the COVID-19 vaccine's efficacy. The new variants are also linked to higher risks of hospitalization and death. To ensure the public is informed on the new variant of concern cases, the City of Toronto will now upload new data on its COVID-19 status of cases in Toronto dashboard, giving more insight on the new variant, specified down to the type, source of infection, and the case counts based on gender, severity, and age. Dr. Davila and Mayor Tory emphasized that Torontonians must continue to follow all public health measures to ensure the city does not fall under a third wave.
But here's the good news. This is really important, and I agree with the observation of the provincial science table. Public health measures appear to be effective against variants, as are aggressive vaccination and sticking with stay-at-home orders.
I support Dr. Davila's recommendations for the City of Toronto because I believe we have to do everything we can to avoid a third wave. I believe the action to be taken today, or the action being recommended today, will save lives, will protect the healthcare system, and will protect people's health, and will, in just a very few weeks, allow Toronto to begin to reopen safely and to stay open.
In Toronto, Canada, Astley Sacmar, Eagle News, we live in interesting times.